Hey, it's Phil.
Hey, it's Kate.
So today we're going to talk all about ingrowing toenails again. We love talking about ingrowing toenails. They're one of our favourite topics because we know if you have a sore toenail, that if you come and see us, we can fix it. It's just what we do. So we have a really interesting document that we use, a flowchart that we use when it comes to treating a patient that comes in for the first time. We've got a couple of options. So we thought we'll talk through our main two treatment options that we use. So Kate, what is option one here?
So option one is where we go a more conservative approach, where we just get rid of the small edge of the nail that's digging into the skin without anything too dramatic going on, basically.
Awesome. So are there any needles needed for that one?
No needles for that one.
Yeah. And so how do you do it? You use some tools or something?
Yeah, so we use a sharp little instrument which cuts down the edge of the nail that's growing into the skin.
Yep.
And just by taking that piece of nail out, it can be immediate relief, really.
Awesome. And does it hurt to have it done?
Not usually, no.
No, if you do it right or
Yeah.
carefully. So if we like you, we'll do it carefully. All right, so that sounds great. So if someone's got an ingrown toenail, and that sounds like a great, and does it, how much does it improve the pain? Like if someone comes in with pain and you do that, what happens then?
So they can pretty much walk out with a huge amount of relief, almost no pain at all.
Awesome. So you keep that in mind. If you're suffering with ingrown toenail, or if you're doing some sort of bathroom surgery at home with pliers and whatever, just don't, and come and see us instead, or see Kate, because she loves doing them. Okay, so that's option one. That's definitely gets a lot of people out of trouble, but sometimes we need option two. So what's option two here? So
option two is for people who have recurrent ingrown toenails, or they're just more severe and need something a bit more drastic, which in that case we go for a surgical option where we use some local anesthetic to numb the toe and then fully remove the edge of the nail that's curling in and causing the ingrown permanently.
All right, so people that will take a couple of needles into the toe.
Yeah.
Do those needles hurt?
The needles do hurt.
Yeah.
They're the worst bit of it, but once they work, then you don't feel anything after that.
Yeah, it's the way I like to describe the needles. It's like a bee sting. Like imagine a bee with to sting you right in the toe. It burn and hurt for about 5 to 10 seconds, and then the local anaesthetic kicks in.
Yeah.
So it's a little bit of pain for a lot of gain, because then we
absolutely.
can do the procedure. Now, will that problem come back again though if we do that procedure?
So the goal is for the nail not to grow back. We use a chemical down the base of the nail to kill it off and to stop it from growing back and causing more ingrowns in the future.
This just sounds great, doesn't it? So yeah, that's awesome. You know, we often have people that have had procedures done multiple times. They'll often see their GP who will cut the edge out, and that's a great short-term solution, but it doesn't solve the problem long-term for a lot of people. So we track all of our patients, so we're a pretty strict protocol we follow to make sure we're getting those good results. And as podiatrists, that's all we do, right? It's sore feet and foot problems. So we do lots of these procedures, and as I said before, we love doing them because we can really change, people's pain levels and get them back to normal. We see people of all ages, don't we, for ingrowing toenail issues?
Yeah,
little
kids all the way up to adults. Yeah.
There's certain times of life where we see them a bit more. So teenagers, we see heaps. Because obviously growing and shoes get a bit tight, playing sports, all that sort of stuff can really damage the nails. So that can be where they start. But we do see a lot of people who are a bit older whose nails might be starting to curl or just misbehave, right? Yeah. And then they ingrow and get sore. So we love to create, permanent solutions so people don't have to worry about them anymore. I reckon that's enough information about our treatment options. But the main thing is, if you're at home with this problem, jump on our website. You'll learn lots about it if you've got more questions. Otherwise, you can call our clinic and chat to our front desk team, because they're really friendly and they have lots of, they're used to talking to people with your problem, so they can help you out. But the biggest thing is getting in as soon as you can so we can solve the problem. We're used to seeing kids, younger ages, and if you're a bit anxious or a bit worried, we know what we're doing, and we'll do our best to make the process really smooth.
Absolutely.
Yes, we will. All right, well, thanks for watching. We'll see you another day.
Bye.
Bye.